You know that health insurance card tucked in your wallet? It probably feels like a shield, right? But what if I told you that for millions it's basically a ticking time bomb? What if the very thing you're counting on for security is actually packed with hidden clauses and costly surprises that could totally wipe you out financially? It's a harsh truth. Countless people are overpaying for their health insurance, or even worse, they're stuck with coverage that's pretty much useless when they actually need it. They think they're covered, that they're safe, and that belief, well, that can turn into a very expensive lie. Get this, a recent survey found that almost half of insured Americans got a medical bill for something they thought was covered. Imagine that shock. That's not peace of mind, that's a financial ambush just waiting to spring. Think about it for a second. One single, unexpected medical emergency can rack up bills in the tens, even hundreds of thousands of dollars. You assume your insurance has your back. But then the explanation of benefits letter lands and your stomach just drops. Denied, out of network, deductible not met. Suddenly, you're staring at a mountain of debt that could throw your whole life off track, all because of a few critical details you missed, or worse, didn't even know you were supposed to look for. We're not just talking about a small inconvenience here, we're talking about life-changing financial ruin. So, one of the biggest traps people stumble into is focusing almost entirely on that monthly premium. It makes sense, doesn't it? You see that low number, and it feels like a win. But this is often where the lie starts to take shape. That tempting low premium can be a total smokescreen, hiding much bigger, way more dangerous costs. Well, there are high deductibles, that's the chunk of money you have to cough up before your insurance even starts to chip in much. Then you've got co-payments for every single doctor visit or prescription. And don't forget co-insurance, which is a percentage of the total bill that you still have to pay, even after you've hit your deductible. All of a sudden, that cheap plan isn't looking so cheap anymore, is it? Imagine you picked a plan with a $200 monthly premium, thinking you snagged a bargain. But it comes with an $8,000 deductible, and then 30% co-insurance after that. If you have a minor bug, maybe a couple of doctor visits, it might seem fine. But what if something serious happens? A sudden surgery, a scary diagnosis. You'll be on the hook for that first $8,000, and then 30% of what could be enormous bills after that, all the way up to your out-of-pocket maximum. That low premium has just snowballed into a financial nightmare. Focusing only on the premium is like judging a book by its cover without actually reading the terrifying story inside. Here's another mistake that can absolutely crush you: ignoring the provider network. Every health insurance plan has a specific list of doctors, hospitals, specialists, and pharmacies they've made deals with. If you go outside that network, your costs can go through the roof, or you might not be covered at all. Think about your trusted family doctor, the specialist you've relied on for years, or the hospital that's just around the corner. You might think, oh, it'll be okay, they probably take most insurance. That assumption, it can be a disaster. Picture this. You're in an accident and rush to the nearest emergency room. You get the care you need, thankfully. But weeks later, a bill arrives for an absolutely insane amount. Why? The anesthesiologist who treated you in that in-network hospital was, completely unknown to you, an out-of-network provider. Or maybe you carefully picked a plan so you could keep seeing a certain specialist for an ongoing condition, only to find out after you enrolled that they've dropped out of that plan's network, or worse, were never in it to start with. Now you're stuck with a horrible choice: pay crippling out-of-network fees, or start the frustrating search for a new doctor, right when you're feeling vulnerable and need continuity of care. You've got to verify that your current doctors, or any you prefer, and your pharmacies are included in the plan's network before you enroll. Don't just assume. Check the insurance company's website, call the doctor's office, call the insurance company. For millions, regular prescription meds are a lifeline. But what if your health plan decides to throw a major wrench in that? Overlooking the details of your prescription drug coverage is a really common and potentially dangerous mistake. Not all plans cover the same drugs, and some might slap you with very high copays or co-insurance for certain medications. Every plan has something called a formulary. That's basically its list of covered drugs. This formulary is usually tiered, meaning different drugs have different cost levels for you. Your brand name medication might be on the highest tier, costing you hundreds every month, or it might not be on the list at all. The plan might also require prior authorization, which means your doctor has to get the insurance company's permission before they'll cover it, or they might push for step therapy, where you have to try and fail with one or more cheaper alternatives. Imagine you rely on a specific medication to manage a chronic condition, like diabetes or heart disease. You sign up for a new plan, just assuming your meds will be covered like they always have been. Then you go to the pharmacy, and the pharmacist tells you it's either not covered, or your copay is now 3 times what you're used to paying. This isn't just about money, this is about your health. Scrambling to find an affordable alternative, or worse, going without your medication, can have serious health consequences. HMO, PPO, EPO, POS, it sounds like a bowl of alphabet soup, right? And it's just as confusing for a lot of folks. But picking the wrong type of plan for what you need can lead to huge frustration and unexpected bills. HMO, Health Maintenance Organization. These plans usually have lower monthly premiums, which is nice. However, they typically make you choose a primary care physician, PCP, from their network. You'll almost always need a referral from your PCP to see a specialist, like a heart doctor or skin doctor. If you see a specialist without that referral or go out of network for anything but an emergency, the HMO generally won't pay. PPOs usually give you more flexibility. You don't typically need to pick a PCP, and you can often see specialists without a referral. They have a network of preferred providers, and you'll pay less if you stick with them. But PPOs usually let you go out of network for care if you want, though you'll pay a lot more. All this flexibility usually comes with a price. PPO premiums are generally higher than HMOs. EPOs are kind of a mix. Like HMOs, they generally only cover services if you use doctors, specialists, or hospitals in the plan's network. But, like PPOs, you often don't need a referral to see a specialist within that network. POS plans try to blend bits of HMOs and PPOs. Like an HMO, you might need to pick a PCP and get referrals for specialists. But like a PPO, you often have the option to go out of network for some services, though it'll cost you more. The lie here is thinking that any old plan will do, or that the cheapest premium is always the best choice, no matter the plan type. If you grab an HMO for its low premium but you constantly need to see specialists and can't stand the referral runaround, you've basically bought yourself a massive headache and potentially huge out-of-pocket bills. It's just human nature to be optimistic about our health, isn't it? So many people choose a health insurance plan based on how healthy they are right now. Sure, you might be fit as a fiddle today, but life is famously unpredictable. Accidents happen, unexpected illnesses pop up. Maybe you're planning to start a family, which comes with pretty big prenatal and delivery costs. Or perhaps you have a pre-existing condition that's stable at the moment but could flare up. Choosing a bare-bones plan with a sky-high deductible and minimal coverage because you feel healthy now could leave you dangerously exposed. You might think you're saving money, but what you're actually doing is underinsuring yourself against what the future might hold. Think about your family history, any medical procedures you might have planned, even minor ones, or lifestyle stuff that might increase your risk. The whole point of insurance, after all, is to protect you from the unexpected. Did you know you might actually be eligible for financial help to pay for your health insurance and not even know it? If you're buying insurance through the health insurance marketplace, like healthcare.gov or your state's equivalent, you could qualify for premium tax credits. Millions of people qualify for these subsidies, and they can seriously lower your monthly premiums, sometimes by a lot. The really devastating mistake here is not even checking if you're eligible or just assuming you earn too much. The income limits for these subsidies can be higher than you'd think. By not taking just a few minutes to see if you qualify, you could be overpaying by hundreds or even thousands of dollars a year. This isn't a handout. It's a system designed to make healthcare more affordable. This one is huge, and maybe the most misunderstood and financially dangerous part of health insurance, the out-of-pocket maximum. This is, in theory, the absolute most you'll have to pay for covered medical services in a plan year. Once you hit this limit, the insurance company is supposed to step in and pay 100% for covered services. For instance, for 2025, ACA plans have out-of-pocket maximums of $9,200 for an individual and $18,400 for a family. The lie here is kind of twofold. First, people often pick plans with those low premiums, but then have astronomically high out-of-pocket maximums thinking, oh, I'll never hit that. But a serious illness, a major accident, these things can send you hurtling towards that maximum way faster than you can imagine. If your out-of-pocket maximum is $9,200, can you comfortably write a check for that amount if a crisis hits? For many, the answer is a painful no. Second, and this is even sneakier, are the things that don't count towards your out-of-pocket maximum. Your monthly premiums? They don't count. Out-of-network care? Often doesn't count, or it has a separate, even higher out-of-pocket maximum. Services your plan decides are not medically necessary or experimental. They don't count. Bills for things your plan just doesn't cover? Don't count. And then there can be sublimits, which are maximum payouts for specific conditions or services, potentially leaving you with unexpected costs. Understanding this number, and what truly counts towards it, is absolutely critical. It's your financial safety net in a worst-case scenario. I'll just keep the same plan I had last year, it was fine. This is what I call renewal roulette, and it's a dangerous game to play. Health insurance plans can, and often do, change quite a bit from year to year. Your premium might go up, your deductible and copays might shift, your trusted doctor might suddenly be out of network. Just letting your plan auto-renew without carefully looking over the annual notice of changes is basically asking for unpleasant surprises. Just as bad is waiting until the absolute last minute of open enrollment to make a decision. Or even worse, waiting until you actually need care to try and figure out your insurance. Rushing the enrollment process means you're way more likely to miss crucial details and end up with a plan that's a terrible fit. You generally can only enroll during the annual open enrollment period, or if you qualify for a special enrollment period. Putting off enrollment can leave you uninsured right when you desperately need care, and you might even get hit with penalties. Take the time, do the research, and don't let complacency or procrastination trick you into a bad plan. Feeling a little snowed under by all this? That's totally understandable. Health insurance is complicated stuff, but knowledge really is power. Okay, we've talked a lot about the problems, the lies, and the mistakes that can be so devastating. Now let's focus on the solutions. Figure out your real healthcare needs. Don't just think about how healthy you are today. Consider your overall health, any chronic conditions, any surgeries or big life changes coming up, and your family's medical history. Compare total costs, not just the premiums. Look past that tempting low monthly premium. You need to calculate the total potential annual cost. That means factoring in the deductible, co-payments, co-insurance, and the out-of-pocket maximum. Verify provider networks like your life depends on it. Never ever assume your doctors, hospitals, or pharmacy are in-network. Use the insurance company's online provider directory, and then, this is key, call the provider's office to double-check. Really dig into prescription drug coverage. Get your hands on the plan's formulary, that's the drug list. Check if all your medications are covered, what tier they're on, and if there are any restrictions like prior authorization. Understand those plan types, match the plan type to what you need in terms of flexibility, access to specialists, and cost. Check for subsidies. Don't leave money on the table. If you're buying through the marketplace, always check if you qualify. Actually, read the fine print. This document spells out what the plan covers and what your costs will be. Don't rush, and don't just auto-renew blindly. Take your time during open enrollment. Think about a health savings account. If you're eligible, HSAs offer a triple tax advantage. Your health insurance shouldn't be something that fills you with fear and uncertainty. It should be a tool that actually empowers you. The lie isn't usually some grand conspiracy. It's the collective illusion that just having an insurance card means you're truly protected. Real protection comes from understanding what you're actually buying, from looking past the shiny appeal of a low premium. The power really is in your hands. By avoiding these common mistakes and doing your homework, you can choose a plan that genuinely protects you. Don't let your health insurance be a lie. Make it your truth, your actual shield. Take the time, make the effort, and if you need help, don't be afraid to ask. Talk to unbiased professionals to help you sort through your options.